All right. I have the pleasure today of speaking with Anthony Magit, uh, one of my personal mentors, um, and somebody who's been very involved in the development of Centac over the years. Uh, Anthony, how are you?
I'm doing well. How are you doing today?
Good, good. Okay, so we're just going to chat for about 15 minutes and go through a couple different questions. First question I wanted to ask you was, can you just give us your brief background and your personal history in pediatric otolaryngology?
Sure. So I went to medical school at UC San Diego, and I became interested in pediatric otolaryngology actually when I was a medical student. I did a fourth year rotation at Stanford doing otolaryngology, and by coincidence, Dr. Bluestone was actually a visiting professor for a week, and he gave several lectures. He rounded with the team, and I was completely enamored of pediatric otolaryngology. Just this concept of working with children, early stages of their life, having a significant impact. And it sort of stuck in my mind how much I really thought pediatric otolaryngology was an incredible subspecialty. And that fit in with my medical school independent study project, which is actually a laboratory project in Dr. Harris's lab. And Dr. Harris is the chair of otolaryngology at UC San Diego. And I actually looked at C and B infections in a guinea pig model. So I was really excited by the concept of a patient population I really enjoyed, plus the potential of doing research and combining the interest in infectious disease. And then after medical school, I did my residency at Duke, and really the entire time thought that I would go into pediatric otolaryngology. And at that time, there weren't that many pediatric otolaryngologists. And when I was a senior resident at Duke, they actually asked if I'd be interested in coming back to Duke after a fellowship and be their pediatric otolaryngologist. So when I went off to Pittsburgh for my fellowship, I was actually planning to go back to Duke to be their pediatric otolaryngologist. And during those 2 years in Pittsburgh, I actually went back and forth, gave lectures to the residents, and all the time just getting more and more excited about being a pediatric otolaryngologist. And the way I ended up in San Diego instead of going back to Durham is that when I was a fellow, one of my responsibilities was being the literature coordinator for one of the first clinical guidelines put out by the AAO, AAP, and American Academy of Family Physicians, looking at clinical guidelines for treating otitis media in young children. And one of the members of the panel was actually Ron Evie when he was still at Mass Eye and Ear. So I became friends with Ron Evie. And one day we were actually at NIH as part of an open forum to get public comment on the guideline. We were having lunch, and he asked what I was going to do at the end of my fellowship, which is only 2 months in the future at that time. And I told him I was going to go back to Duke. We talked a little bit about where I was from. I'd been a medical student at UC San Diego. And he said, "Oh, do you want a job at UC San Diego?" And I asked him, "Well, why are you even asking me that?" It turned out that he was a resident with Jeff Harris, who I had already known as a medical student. And Ron Evie said, "I'm going to tell Jeff that you want a job." I said, "That'd be great. I like San Diego. Duke is a wonderful place, but my wife and I are both from Southern California." So sure enough, about a week later on a Saturday morning, Jeff Harris called me at my house in Pittsburgh and said, "Hey, Anthony, Ron Evie tells me you want a job." And that's sort of how I ended back in San Diego. The people at Duke were incredibly wonderful to me. In the fact that I called the chairperson, I said, I feel horrible. I love Duke. It was a great experience. I really want to be on faculty, but I have this opportunity to go home. And he says, nothing beats home. But they did say, if you ever decide you don't like San Diego, please give us a call, because there'll always be a place for you at Duke. So I've been very, very lucky in my career.
Excellent. And tell us how you got involved with Centac, and share with us some of your earliest memories of Centac.
I really got interested in Centac because of Sylvan Stoll. Sylvan was one of the attendings in Pittsburgh, and obviously a lot of people at Centac know Sylvan. He was really an incredible man, huge heart, just really enthusiastic. And Centac was a meeting that he always enjoyed. It was interesting because Pittsburgh, Dr. Bluestone was a little bit more of the ASCO person. Centac was a little bit more sort of Sylvan speed, as it were. So I went to my first Centac meeting basically with Sylvan, and just really fell in love with the organization, just the multidisciplinary nature, just the camaraderie, and the whole ambiance of Centac was just something that, I may be a little biased, but Sylvan always said it was his favorite meeting. And I think after the first time I attended a Centac meeting, clearly became my favorite meeting of the year.
I unfortunately never got the opportunity to meet Sylvan Stool. We have awards named after him, and there's always so many great stories. Is there any funny story or anecdote you can share with us?
Only for public consumption, I probably have a couple, but one of them was great because Sylvan was a great teacher. He also was very innovative in photography. As well. Two stories real quickly. One is that Sylvan had recording of Strider and children crying. And Sylvan would use these for teaching. He would correlate the sound as well as the anatomy, the pathology. And there were several times you're sitting in your office, and Sylvan's office is down the hall, and it sounded like these children were either ready to obstruct or were in incredible discomfort because you heard crying and Strider coming from Sylvan's office because he was editing the audios. That was a very interesting experience. And then one year they had the first international meeting of the airway in Cleveland. And I was sitting with Sylvan during the meeting. I think Jerry Healy was giving a talk and some other people were giving a talk. And Sylvan was so generous with all the endoscopic photos that he took, and fellows would take them, and then these fellows would then share these photos with people around the world. And Sylvan elbowed me and said, "Anthony, I know that airway, that's my patient, but I have no idea who the person is who's giving the presentation." So he wasn't upset by it. He just was fascinated with the fact that some of the photos and educational materials that he developed were so widely disseminated. And that was something about him which was just incomparable, unbelievable.
Very cool. So you got involved in Centac, and I believe you were president, was it 2013? 2012. 2012.
Yeah.
Tell us how you got involved in Centac, and how you were involved in the society through the years and worked your way up to president.
After going to several meetings, got to know people in leadership, and then after being on the board, then I became the secretary, and I was secretary for a long time. And this was way before computer applications. So I was secretary, I can't remember how many years it was. And just every year I worried that I wasn't getting people's applications. The applications came to the mail. And I was always afraid that you would go to a meeting and make your list of new applicants, and someone would pop out of the woodwork and say, "Hey, what's the deal? I sent my application in 6 months ago. I'm supposed to become a new member." But I got over that, became somewhat organized. And so I was secretary for several years, and then honored to become the president. And in Centac, there was always that stress because you were the program director the year after you were president. And I have to say that was something Centac debated for years, because most societies you'd be the program coordinator first, and then being the president was sort of icing on the cake as opposed to the other way around. So we talked about flipping that. And I'll be honest, how is the situation now? Because I haven't been on the board for a while.
It's
Is
the
it
same.
still that program is after your president?
Right. And we
Yes.
had that same conversation. We actually did this last year, and decision was made to keep it the same.
Yeah, because we talked about if you did that, somebody would get away with being president, never having to be the program director. Nobody was willing to do that for somebody. But it was great. I mean, I think my interest in Centac just continued to grow. Obviously, it was always, I think it really has turned a corner. There was that concern for a long time, which is probably still a concern. People have done fantastic things to bring non-physicians to meetings. And we had those discussions, back when I was the president. And I think that's been always such a wonderful part, because there was concern at some point that it would be dominated by physicians. And then it would just turn into another medical society and lose some of the uniqueness. And I think that really has been able to maintain that diversity, which is so critical to its success.
Yeah, it really is such a special environment when you're at a Centac meeting, and you see this really collegial discussion going between different disciplines, and people are, cordial and nice. And personally, what I remember first was how clinically applicable it was.
Right.
It wasn't just deep data and research. It was situations that you come across every day when you see patients in the office, and in having the speech therapist or the audiologist or the person you don't always see in clinic with you, but who you're working with, have that conversation with you or with whoever's the panelists are. It's so unique and interesting, and there's so much you can take home that you can use right away. So it's been so interesting how you guys have built that through the years. And I think it's continuing. And I think
Mhm.
we're seeing more and more non-physician membership actually join our society.
Yeah, it's a marvelous organization. I mean, it always had good content. I think now people are even presenting more basic science and complicated research, but it's still maintaining that clinical orientation. I think also we introduced a lot of the panels and the breakout sessions, so people have the opportunity to converse in smaller groups that really you can talk about how people manage particular conditions, which I think has been just a real great addition to the program. And an environment, one of the things people talked about early on was that it was an environment that you could get trainees to participate in and they wouldn't be intimidated. And I think that's also something I'm just impressed. Just overall, I think trainees are more sophisticated than they were when I was a resident or a medical student. For some reason, it seems like they're more mature and more confident in their presentations. But Syntac amongst otolaryngology was known as an opportunity for medical students, residents to present in a friendly, less intimidating environment.
Yeah, so thinking back to the year that you were president and program director, let us tell us about what your goals were at the time, what challenges you had, and how things went those years.
I think one of the major goals was to maintain diversity. So we talked quite a bit about having non-physicians come to the meeting. And I think I don't want to say take credit, but it was trying to broaden the scope of what we were discussing. And I know one of my close friends from residency is actually a chair in ethics at Johns Hopkins. And I was thinking about this the other day that I had him as a guest speaker. And he was fantastic. He talked about his experience as an ethicist and what it was like to consider clinical trials and ethical concerns, especially access to care. And probably the biggest thing I felt satisfied was that Bob Rubin was completely enamored with this friend of mine because he was not your standard otolaryngologist. He was an internist by training and a trained ethicist. So I just remember at the cocktail party, which typically would happen the night before the meeting started, sort of the happy hour, people would just sort of show up. Bob Rubin sort of took my friend aside and even had him write an article for the International Journal. And Jeremy always laughed that Dr. Rubin would send him articles to review. And Jeremy was trying to figure out why was he being asked to review articles for a pediatric otolaryngology journal. So I just remember that meeting, being very, that was the presidential meeting. I thought it was very satisfying. I think that's when we really started to move into, broader focus of what are the implications of pediatric otolaryngology medicine in general.
Yeah. So do you remember the first year that you went to a Syntac meeting, and maybe reflect on that and talk about how you've seen the society and the meetings change over the years?
I think what I've seen is the complexity of the research. And I think that's just the nature of medicine. I think you see the quality of some of the basic science presentations, as well as the very clinical presentations. And I think a lot of that has to do with people's comfort, also technology. I think some of the best presentations are by our speech therapists or audiology colleagues, and some of the technology, the endoscopies, the modeling that they present is very, very sophisticated. So I think that's something that we've seen. And also, again, the multidisciplinary panels, which have been such a success. I think the first one I went to, I want to say it was in New Orleans. Because I just remember being with Sylvan in a restaurant and some street corner in the in New Orleans, and I had that recollection. That's where it was. I also remember a really cold time in Atlanta. So but it's always been a great meeting. I remember one time I couldn't go because of an illness in my family, and it was very funny. This is way before pandemics, way before telemedicine and prolonged conversations. But I was the secretary. So this is when the board meetings, they probably still are 2-3 hours. So I was the secretary, but on the phone the entire time, keeping notes. And that was the year in Milwaukee. And there was concern because there was going to be a big storm, and people want to make sure that we had meeting insurance. If the meeting got canceled, that we wouldn't be responsible for the cost of the hotel. But ultimately, people made it in despite the storm. I was sitting in the office in San Diego. But it was so funny because I was in this board meeting, and it just showed how you can be so engaged in a conversation, even though it was audio only. This is before Zoom. This is audio only. But for years subsequent to that, people would talk about the meeting in Milwaukee, and I'd swear that I was at that meeting because I felt so connected during the board meeting.
That's great. Okay, so last question. What message would you like to share with the young trainees and the next generation up and coming about what you've learned as a pediatric otolaryngologist and your time with Centac as a society?
Amongst the many things, I think that you're really an ambassador. I think, I've been a pediatric otolaryngologist now for, 3 decades. So I sort of see medicine through that lens. But my experience is that otolaryngology is very collaborative. And it just seems to me that we work with other professionals who are not physicians really side by side. And my recommendation would be to really seize on those opportunities, both from career development, developing friendships, developing clinical programs, developing research interests with non-physician colleagues. And I think that's something that really fits along with Centac. And the other thing I'm finding now, which is interesting, for otolaryngology being a relatively small specialty, and pediatric otolaryngology in particular, that we are really privileged. We talk about otolaryngology being this incredible combination of medicine and surgery and development, and the fact that we deal with senses, we deal with oncology, we deal with airway. But I think the thing that really, from a clinical standpoint, which is so fascinating, is we interact with everybody in the hospital. And I think this is something to really seize upon. So remember people's names and take advantage of being on committees that realize that just by default, as an otolaryngologist, you are going to know everyone in the hospital. Every physician's patient has an airway, and that's how you get to know them. And the infectious disease people know you, and all the pediatric specialties, obviously gastroenterology, pulmonary. And this is something that really sees on that early, because you never know what friendships you're going to develop. You don't know what research opportunities, because you're going to interact with these people on an ongoing basis. And this is the lesson for me, is that I think a disproportionate number of otolaryngologists become leaders, become administrators. And I think part of it is, I think inherently we tend to be nice, whether that's a bias of who goes into otolaryngology or what otolaryngology does to you. But you know everybody in the hospital, and it really amazes me to this day that sometimes I'll talk to somebody who's been at Rady for 30 years, an orthopedist, for instance, and there's a urologist, or probably a non-surgical person, but a nephrologist, that, or a neonatologist who I've known for 30 years at Rady, and the orthopedist won't know them. I say, how can you not know them? And then you realize there wasn't really a lot of opportunity for them to interact. So take home lessons. You're fortunate you're going to interact with everybody. Take advantage of that to seize opportunities, to be on committees, take advantage of research opportunities. And also community outreach is another, that you really are in this interesting position that some other surgical specialties don't, because children, parents understand about hearing loss, they understand about breathing problems. So we can go from the very sophisticated to the very straightforward and understood by families and patients.
Awesome. Well, I just want to thank you for everything you've done for our specialty, being a pioneer, everything you've done as a mentor for me and for multiple fellows who've come through Rady Children's, and everything you've done for the Centac Society for many, many years. You're a very special person. Everybody who knows you knows that. And anytime I go anywhere, everybody always asks me about you. Oh, how's Anthony doing? Yeah, and you're just so beloved by everybody. And I just want to thank you again for taking the time to have this talk and for everything you've done through the years.
Well, thank you. I can tell you, Centac has done a whole lot more for me than I've done for Centac and the members, but I really appreciate that, James, especially coming from you. That means a tremendous amount. So thank you.
Awesome. Thanks again.
Thanks.